Hi everyone, my name is Dhruvi and I'm a fourth year pharmacy student at the University of Toronto, currently doing my rotation at Wholehealth. Today I'm going to be presenting on the recent legislative changes in the sales of nicotine replacement therapies, focusing on Zonnic nicotine pouches. Here's the agenda for this presentation. I'm going to start off by explaining legislative updates, why they're enforced, and then going into what Zonnic is, its place in smoking cessation therapy, and how the new legislation affects Zonnic. Lastly, talking about the pharmacy's role and some key takeaways. On August 28, 2024, the federal government announced changes in the sales of certain NRT dosage forms. Nicotine pouches and sublingual tablets are to be sold behind the counter in pharmacies only, not available for self-selection. They're no longer available in convenience stores or online, and pharmacists or a person working under the supervision of a pharmacist must intervene and assess the appropriateness of the sale. Only mint and menthol are NRT flavors authorized for sale, and NRTs in the form of gums, lozenges, inhalers, metered dose sprays, and patches are the exception and continue to be accessible for self-selection. Updated labeling, packaging, and advertising standards are in place for all NRT dosage forms for companies to follow. And so the Government of Canada has given 6 months for the implementation of these labeling, packaging, and advertising changes for all NRTs. Brands must not sell nor advertise products that are misleading, so the consumer must know that this product is intended for smoking cessation. It should not be appealing to or associated with young people with respect to the way it's presented, and it should not be potentially mistaken for cannabis or food. Labeling must include clear warning statements regarding nicotine, so it should state that this product is for those 18 and older, nicotine is highly addictive, and this should only be used for smoking cessation. During this 6-month transition period, you can still sell NRT products that are not in accordance with the new legislative requirements if they were labeled prior to this order coming into force. The same is applied for advertising. After this period, which would be February 28th of 2025, all NRTs being sold and advertised must abide by the updated standards. Why is this happening? Well, the goal is to limit access and appeal of these products to adolescents and people who don't smoke in the first place. And the rationale is that marketing and sales of NRTs have become increasingly similar to that of vaping and tobacco products, blurring the line between cessation therapy and products for recreation, essentially promoting the use of nicotine. And these newer dosage forms, like the pouches, can sometimes be packaged and advertised in bright, appealing colors and can be promoted to young people through celebrity endorsement. And studies have found that young people often start using NRTs as they perceive them to be a little bit more safer than cigarettes. However, they ultimately become dependent on nicotine and it leads to cigarette smoking. A CDC report in 2023 stated that 1 in 100 U.S. high school students reported using pouches in the past 30 days, and our government has taken these trends into consideration, thus enforcing these updated rules. We are aware of the effects of nicotine, however, premature use can cause negative cognitive effects in young people, such as learning and behavioral problems, concentration and memory issues, as well as exacerbation of symptoms for anxiety and depression. And so this new enforcement can reduce the demand in the healthcare system associated with nicotine dependence in young people. Amongst products to be sold behind the counter are Zonnic nicotine pouches, and they're indicated for the temporary control of cravings and reduction of withdrawal symptoms. The company also advertises its use for when smoking is prohibited. So, for example, a patient is on a plane and they need to smoke, however, they can't, therefore, they can use one of these pouches. It includes roughly 4 milligrams of nicotine per pouch, which is equivalent to 4 cigarettes on the basis that 1 milligram of nicotine is approximately 1 cigarette. And the pouch is placed under the upper lip for 60 minutes, absorbed through the gums, and it should not be chewed, crushed, or swallowed. And currently, it's the only nicotine pouch authorized for sale in Canada. In terms of dosing, a patient starts using this every 1 to 2 hours as a craving persists in the first month, and over the period of 6 months, the frequency is decreased. Contraindications to this product include allergies, pregnancy, seizure risk, non-nicotine users and occasional users, and those less than 18. Common adverse effects include lightheadedness, nausea, and hiccups, and a patient should stop using this product if they experience irregular heartbeat, an allergic reaction, vomiting, diarrhea, sweating or confusion, and blurred vision. Just going to briefly touch on the first-line therapies available for smoking cessation and where Zonnic comes into play. So the first-line therapies, according to the CanADAP guidelines, include varenicline, bupropion, and nicotine replacement therapy. Out of the three, NRTs are considered natural health products, and they're available in multiple dosage forms, available without a prescription, making them the most accessible treatment option. And so how does Zonnic compare to other NRTs? Well, I'm going to highlight the main points out of this chart comparing all dosage forms. The patches are the only long-acting option. All other ones are short-acting. Zonnic advertises their product to be a bit more discreet than the gum, and the inhalers are actually puffed similarly to a cigarette, which can be preferred for some patients. And the lozenges actually have a similar bioavailability to Zonnic, and therefore the dosing is quite similar. However, at the end of the day, it comes down to patient preference. So what's all this new legislation got to do with Zonnic? Well, as stated before, it's a nicotine pouch, not amongst the list of NRT dosage forms available for self-selection. Therefore, it must be kept behind the counter. The legislation also stated that only mint and menthol flavored NRT products are to be sold, and Zonnic used to come in 3 different flavors. There was Tropic Breeze, Berry Frost, and Chill Mint. Now only mint is available, the other flavors being discontinued. And it's no longer available online for purchase on their website. Now going into pharmacy role. So if you're a pharmacist and a patient comes into your pharmacy asking for Zonnic, how do you proceed? Well, we know it's sold behind the counter, so now a pharmacist must intervene in the sale. And so if someone asks for Zonnic, you want to confirm the age and ask if the patient's used it before. I will note that ID checking is not currently required and decisions should be based on clinical judgment. And so a pharmacist can actually sell an NRT product to those under 18 if appropriate. If the patient's never used it before, you want to confirm what they're using it for. You want to ask if they've used anything else for smoking cessation, and also confirm allergies and concurrent medications, going into how to use this product and potential side effects. If a patient has used this product before, you should still ask some questions to assess the tolerance and effectiveness at each visit, just to ensure that this remains the most optimal therapy for this patient. In terms of added workload, a sale of Zonnic only takes an extra 30 seconds, and it takes approximately an extra 5 minutes for the assessment and consultation. And the red asterisks indicate potential reimbursement opportunities. And so here's the reimbursement across Canada for each province for prescribing and for counseling. And so please note that NIHB does not cover Zonnic, however, it does cover other NRT products. And here I've shown the private payer reimbursement from Green Shield and Blue Cross. And so this differs from province to province. Stocking of Zonnic can be done through McKesson. If you were to search up Zonnic on McKesson, this is what you would see. And so the D's and the T's indicate that this product has been discontinued. And so only Chill Mint is available, which is the only one that should be stocked and sold. The item number and the natural product number are listed on this slide, and the retail price varies from $13 to $15 per pack plus tax. And so that brings me to my key takeaways. Essentially, the misuse of NRTs has prompted the government to make some legislative changes. If you have Zonnic in your pharmacy, move it behind the counter, intervene in the sale, and only sell Chill Mint. And you can still sell NRT products with older labeling as long as it was labeled prior to the change in legislation during the 6-month period, which after you should only sell products that abide to the new standards. So here are my references, and that concludes my presentation. Thank you all so much. And if you guys have any questions, please contact Molly. Thank you.